Hello, everyone. Friday the 13th. Here we are together for SADS Live again. I don't even know what number it is. Maybe somebody will tell us in the chat room. 127, our 127th episode. Well, I love to get to be with you. I've missed you all. It feels longer than 2 weeks, but I guess it hasn't been. And I look forward to seeing who's joining us live, whether you're here in North America on afternoon time, over in Europe on evening time, or down under with my little brother. I guess he's my little brother, Dr. Chris Samsarian in Sydney. Wherever this finds you and wherever you are, welcome to SADS Live. And on behalf of Alice Laura, the CEO of the Sudden Arrhythmia Death Syndrome Foundation, the SADS Foundation, we're glad you're joining us for this month of October, which is Sudden Cardiac Arrest Awareness Month. As a declaration. And I'm Mike Ackerman. If you don't know, I'm a genetic cardiologist here at Mayo Clinic in Rochester, Minnesota. I have the privilege of serving as its director of the Mayo Clinic Winland Smith Rice Genetic Heart Rhythm Clinic and our complementary Winland Smith Rice Sudden Death Genomics Laboratory. But for a lot of years now, I've partnered with Alice Laura, our CEO of the SADS Foundation, to serve as the president of its board since 2006. And we love doing these programs. Today's a special one, but I would be remiss to ignore what's going on in our world on this Friday the 13th, what happened in our world 6 days ago on Saturday the 7th, which really is the Pearl Harbor of Israel, the September 11 of Israel, and worse, when this inexplicable unprovoked Hamas terrorist attack has killed over 1,000. I think the latest count is higher. And if you scale it to the population of Israel compared to the population of the United States, that would be the equivalent of 30,000 human beings in the United States dying on 9/11. And so my heart grieves for the people of Israel, my family's heart. We have trained many from Israel. We have a beautiful relationship with several of the universities in Israel. There's a special relationship between our institution, Mayo Clinic, and several of the medical universities at Israel. Several of their physicians have trained here. I'm thinking of a very special adult heart rhythm specialist down in Texas who trained with me and whose father gave me the shofar as a gift. And so I stand with Israel. No difficulty in doing that. I have no problem opening my mouth and speaking rejection of the hatred that we're seeing, the anti-Semitism, unacceptable, and just grotesque. So my heart grieves. I think of them, and I hope you all will join me in praying for the protection of Israel. So with that, on Friday the 13th, we have an incredible program today from an organization that I love. It's a company called LifeSure. And for most of my families, almost all of them who are minors, children, I tap into LifeSure to have them help me help those families secure an automatic external defibrillator, an AED, as part of family safety gear. And I'll tell you the why, and we'll do the why together when we bring them on. And the why is not out of necessity in the sense of my patients are dangerous, vulnerable, twitchy, on the verge of tragedy. No, not at all. It's like my seatbelt in my car. I wear it, put it on all the time. So far, I've never needed it. It's like my fire extinguisher in our house. I know where it is. I know PASS, right? Point, aim, squeeze, spray. But I've never had to grab my fire extinguisher, but I know where it is. I know how to use it. And that's how I see this safety gadget for my families with sudden death predisposing genetic heart conditions. And it's whether you're a family who's joining us with long QT syndrome today, ARVC, ACM, CPVT, whatever the reason, I've often regularly add an AED recommendation. And in the days in the past, it would be, yeah, try to get one, and see what happens. Let me know if you need help. But we at our program at Mayo Clinic, the SADS Foundation has found a tremendous resource with this company called LifeSure. And I'm going to bring on two wonderful people from the company, Meg Weber, an RN who is the director of patient advocacy and education for LifeSure, and one of her colleagues, Jackie Estevez, who is a claims specialist who's doing what I call that pit bull tenacity to try to get it approved. So Erin, in the wonder of her amazing stuff that she does, is going to bring them on. So welcome to SADS Live, Meg and Jackie. Great to have you two.
Thank you so much, Dr. Ackerman. We're so happy to be joining you today.
Thank you. Yes, exciting.
Well, first and foremost, I want to just thank you on behalf of our families with SADS conditions for your incredible work. I think what you do is incredible. Full disclosure, I have no formal relationship with LifeSure. I have no financial entanglements. I'm not even a consultant for LifeSure. I'm just the genetic cardiologist who uses you and your company and your skills to help virtually all of my families. And so when we think about what you do, tell me a little bit about what LifeSure actually does to help our SADS families secure an automatic external defibrillator.
Right. So LifeSure, basically, our mission is to equip these families that are in need with AEDs for home use that they carry with them at all times. Because like you said, although it is our greatest hope that you will never have to use this device, in the event of emergency, we want you to have it with you. So typically the insurance companies, they are not inclined to cover these devices at first. So LifeSure really does the legwork of advocating on behalf of the patients and the families to get these devices covered by their insurance. And then not only that, but we're with you every step of the way from beginning to end and even after that. So LifeSure is going to equip you and your family with the resources and the knowledge, the training to be able to use these devices in the event of an emergency. And we have a 24/7 customer care line where you can call in with any questions after we service you. So we're here for you always with support and resources regarding anything that you need with AED.
Well, that's great. Thanks, Jackie. And Meg, in your role as the director of patient advocacy and education, what do you find yourself busy doing to enable that success that LifeSure has achieved to happen?
Yeah, I work with our team. I have the patient advocacy in my title, but like I like to say to Jackie and the rest of the team, like everybody at LifeSure is the advocate. So I just get to have that part in my title. And I work with providers like yourself to get the paperwork needed to submit these requests to the insurance companies. And then I also am the one that's doing the training for families on their AEDs and being that support that Jackie was just talking about, answering any questions and kind of being the liaison between the families and the providers and our team working with the insurance company.
And I know in some ways our success at preventing tragedy has made it somewhat of a challenge for you to secure the AED or to convince the insurance company that no is the wrong answer. And what I mean by that is in our entire program, so I take care of, I think at last count, about 1,800 patients with long QT syndrome. I almost always recommend the AED for the pediatric patient, the adults less so because it doesn't make sense in some ways in terms of where is it going to be, who's it going to be with. But so say we have 900 children, and in 23 years, we've only had 4 AED rescue shocks given to 4 of those 900 treated children. So we almost never, ever need this safety gadget. We've published that, and I think insurance companies have used that as ammo to say, see, they're not necessary. We're not going to cover it. And yet they don't realize the power of the protection of the safety net. How hard is it in light of that for you guys to get it approved? I describe LifeSure as the pit bulls who refuse to take no for the answer from the insurance companies and keep at that until they realize that the correct answer is yes.
And that is exactly what it is. We just will not take no for an answer. It is amazing work that you do with these patients, and 4 in 23 years out of 1,800, that's amazing. Me as a mom, thankfully, I'm fortunate enough to have a child who's very healthy, but if my child, God forbid, were to be the 4, I would want to have the device. So that's really how we explain it to the insurance companies, and it is a fight. And the great thing about LifeSure is that we're gonna relieve the families of that burden of having to fight with their insurance company. So we're going to appeal these denials. We're going to be on the phone for hours on end. We're gonna present all of the information. And like you said, while it's very rare that it would need to be used, we just want to make sure that in the event that it does, that you're equipped with it. So it is countless hours of paperwork, appeals, phone calls, reconsiderations, and it is really a fight, but we get it done. So I would say 95% of our authorization requests are denied up front, and then that grueling process of fighting with the insurance companies can go on for months at a time. So it is very labor intensive, but we want to do everything that we can for these families in order to get the device to their children who do need them.
So what gets them to change their mind? So it's amazing that if you guys start out with 95% denied, how is it, at least among, I would bet, and you probably know the data better than I do for even my own patients, but it seems like you secure a device for my patients at least 95% of the time. So you go from a 95% denied to a 95% victory. How do you guys do that?
So it's just presenting them with the information. We have actually a patient who just recently came to us. She was 12 years old and she was at a swim meet, and she dove into the pool and she's swimming to the other end, and on her lap back, she was supposed to have 3 laps back and forth, and on her second lap back, she started sinking to the pool. One of the swim instructors, not even her instructor, but just one of the swim instructors that was in the audience, recognized that she might be suffering from a cardiac arrest, jumped into the pool to save her, pulled her out, ran and grabbed the defibrillator, and they were able to save that patient, luckily with the use of the defibrillator. So we, then the parent, was referred to us, and when we submitted that information to the insurance company, what do you know? They denied the authorization. Even having all of that information that this device saved this child's life, they were still saying it's not medically necessary. So we use instances like that and cases like that to bring awareness to the fact that, as you said, even though there is a good chance that they won't have to use it, there is still, it's not a 0% chance that they will never use it, So we kind of focus on that, on, well, what if they do? What if they do need to use it? And like I said, that goes through several levels. It's not just a one-time, well, hey, this is what happened and this is why the patient needs it. It's many levels of fighting and fighting with the insurance companies. And I've actually had to go to the insurance commissioners and file complaints, because we do get granted exceptions where the insurances will say that it's not covered, and then we are granted an exception to cover the unit based off of information that we provide to the insurance, and they will still, once we submit the claim, deny it, saying, well, no, we don't want to cover this. So that's when it becomes very involved, and we have to then take other routes by, like I said, unfortunately filing complaints with the insurance commissioner, or getting provider network specialists involved and things of that nature.
Well, you guys are amazing. And Meg, Jennifer has a great question. She's wondering, does a family have to have a prescription for an AED for a pediatric patient with long QT syndrome? In other words, what if their own doctor is sort of, we don't need this, I don't recommend this, I don't advise this, and the doctor is hesitant to providing a script? Is a prescription mandatory to get the ball rolling?
It is part of our process that we need that to submit to the insurance company, because without the prescription, then they can say, well, why wouldn't we need this? So in that type of situation, I would call the doctor's office and talk with the doctor or the nurses and try to explain why we need this with the insurance company. And usually along with the diagnosis and the clinical information and genetic testing, if that's been done, a lot of that stuff proves the fact that an AED would be necessary. So we would work that route to try to get the doctor to say, okay, this is needed.
Yeah, I agree. And I think it's an interesting question, which, we could have a long conversation about healthcare providers, doctors, nurses being paternalistic versus being partners. So I could make the argument as the doctor saying, look, my patients never need this device. Why bother? And yet I would never tell a parent that I'm not going to provide a prescription for the AED if that gives you an extra layer of peace of mind. And so part of my quick reaction as I was reading this on the side was, maybe time to get a different doctor, because I find that refusal to provide a prescription for a family with one of these conditions to honestly be a bit unacceptable. But I don't encounter that. Do you encounter that very often where the families are reaching out to you and saying, like Jennifer suggesting, that their doctor won't give the prescription?
No, actually, it's really the opposite effect is we get prescriptions just on their own. And then I have to say, okay, that's great, but we need all the rest of the supporting documents as well. So in my experience, that has been really the opposite effect.
And maybe Aaron will be able to pull up the SADS live number. And maybe it was last October where I usually tell my families that, given how well your child is treated, that this AED that we're going to add on as part of your safety gear. And for my athletes, it's actually a mandatory part of their athlete safety gear as a above and beyond precautionary measure. I typically tell them that this AED is going to be far more likely to get used on the referee or a grandparent watching the game in the stands and not on you, my patient, treated and diagnosed. And it never had really happened yet. But we did a program last year because it actually did happen, where the referee of the soccer game, he went down and the dad ran out and got their son's AED and brought that 60-some-year-old back to life from his coronary artery disease triggered lethal rhythm, and saved the umpire, the referee. Do you get stories like that where the family's AED got used to save somebody else, meaning the person who didn't know they had anything wrong with them?
Yes. So we do have a patient that her dad went into sudden cardiac arrest, and the mom used a defibrillator on the dad. So we came to know of that because they needed replacement pads, of course. So we have that instance, yes, where the device was used on a family member.
And how many do you keep track of the data, or do you necessarily get that? So I told you I only have 4. Are you aware of more families where that safety device was necessary for the patient in which the prescription was provided for?
Yes, so we don't have an exact number. The only way that we would be able to, the machine does track that data. However, the only way that we would be able to obtain that data is from the parent calling in, or the family's calling in to let us know that the device was used, and then we could pull the data from the device, but they would have to bring it back into us. So we don't have an exact number of uses for patients that we provided the AED for, only because, like I said, they would have to call in and let us know that information. And maybe there are some that we don't know of, but
right. You would think that if the AED provided, secured by you all, got used to save their child's life, that you might get that phone call. So I'm just curious, is that would you say a weekly phone call, monthly phone call, where one of these call-ins will say, you know what, this device just saved our family member, how often do you get called? Because one could make an argument that maybe our number is so low because hopefully perhaps we also have the secret sauce in tailoring their therapy, and maybe for other patients their level of protection might not be equal. Don't know. That would be a little bit wanting to think that maybe we're good at what we do. But how often do you get that phone call?
I agree. You have an excellent care regimen. And actually, the mother that I was speaking of earlier with the child at the swim meet, we spoke with her recently, and she did say that she was going to be seeing you soon because her current cardiologist, she's not happy with the care regimen. He did want to restrict her child from all sports indefinitely, from any physical activity, and she just doesn't want to diminish the quality of her child's life in that way. So she had heard from the community just of how great you, Dr. Ackerman, your care regimen is. So she did say that she is in the works of trying to see you, which is great. Speaks volumes to your practice.
But for you, do you think you get one of those success story phone calls once a month, every 3 months? What I'm just curious if you.
It's more in the range of once or twice a year. It's definitely not monthly. But yeah, so it's not a staggering number. But when we do get phone calls like that, that's why we do this, you know.
Right.
And it's just so fulfilling to be a part of something so great. So if it's one child a year whose life is saved by the work that we're doing here, that it's phenomenal.
Yeah. And then what do you do, Meg? So we prescribe the AED. You guys you start from 95% deny to 95% yay. And then it gets FedEx to the family and they're just left high and dry to figure it out on their own? Or
of course.
A drill?
No. So once the unit is shipped out to the families, I contact them and I set up time to do a video training on how to use the device. I go through all the buttons. We use my trainers to show exactly how it would be used in a scenario and answer any questions that they have. We record it if they want to. I do multiple trainings, whether it's for daycare providers or school people or whoever that their family wants me to train. And then I'm there for them with any questions following up. After my training or when we're doing the training, I say, if you want a monthly training, I will do this with you monthly. If you want phone calls to just talk through stuff or any questions that you have, I tell them to call me anytime.
That's great. And that training, does it take a bachelor's degree to eventually get good enough at it, or is it pretty easy?
It's very simple. Anybody can use it because the device talks you through each step of the way, and it keeps up with you. So if you're nervous and anxious, because this situation would be very scary, and you're taking time and you're listening to everything that the machine is telling you, it keeps up with you. If you already know what to do and you skip, you're going very fast, the device keeps up with that too. So you're never going to miss a step. It walks you through everything that you need to do, and then success, by delivering the shock.
Yeah, I got in the doghouse with that because my wife of almost 35 years, the same one, she was a flight attendant for 20 plus years with Northwest and Delta Airlines, and I would always tell my families, these devices are so easy that the flight attendants know how to use them. And so I got in a little trouble with that one, but
I would imagine.
but they are easy. There's actually a cool study, I don't know if you've seen it, that compared, I think it was 12-year-olds, 6th graders, and compared them without instruction, just taking the device out of the box and executing it, compared to trained first responders. And I think the 6th graders executed the shot correctly, only about 30 seconds slower than the trained EMTs. So I think that's just, it's a reflection that these devices are so user friendly, and then with a walkthrough that you all provide, that the families can be really confident. They don't have to be nervous that they won't have a clue what to do if they were to become my 5th patient, for example, who needs it.
Yeah.
And you guys do a great job of also providing that training, even though those 6th graders didn't get any training and they were really good.
Right.
Absolutely.
If they're not covered, so ultimately we have maybe 5% where you try and try and try and they say no. I know the price, but the cost of a gadget is not astronomical anymore. What is the current? I haven't looked it up recently. If I go to Costco or Sam's Club to get one of these automatic external defibrillators, or if I go to the website, I guess there's aedprofessionals.com or something. What do these cost now? If insurance says denied, denied, denied.
So they can range depending on the device. I would say that the average cost is about $1,500. However, in the event that we, like you said, try it, and we just absolutely cannot get the unit covered through insurance, we do have grants available that we utilize in the event that we just have exhausted all other options. Because we do, eBay and Costco and all those things, those are great. Those are retailers. It's a cash sale. You're never gonna hear from them again. And the devices are very user friendly, which is amazing. But in the event that something happens with the unit, I just had a parent call me the other day because her unit was beeping and she didn't know what it was. If you buy the unit from Costco, who are you going to call? They don't know why the device is beeping. So it turns out that it was just performing a self-check, which it does over 3 to 4 months, depending on the different device. So she was all worried, obviously, and she called in and she's like, my device is beeping. I don't know what's wrong with it. And we walked her through it, and ultimately it was just performing a self-maintenance check. But we want to try as hard as possible to get a device covered through your insurance. But in the event that we can't, we do, like I said, utilize grants and things like that, because we want to be a support system for our patients. We don't want to refer them to.
Yeah, and it's incredible what you do when you do provide that care. And I know there have been times where we've ultimately have had a LifeSure denial where the SADS Foundation has stepped in and bought that device for the family. But then you all have then provided the training that Meg was describing so that no one gets left behind. How often, last question for you, unless I see one come in from our friends on SADS Live, you get the gadget and the battery and the pads last forever, or no?
No, that is also dependent upon your unit. Most of the time, the pads can last from 2 to 4 years, and the batteries are usually about 4 years. So each unit have a little bit different of expiration date. I did hear recently that they are trying to make this more universal and make everything 4 years, but we haven't gotten there yet.
So it's roughly every 4 years. And let's say that family out there becomes my 5th family to get a rescue from the AED. Is that one and done for that device, or does that device then need new batteries, new pads, or can they still be used again?
Yeah, the whole unit can be used again. The pads are a one-time use only. The battery, it depends, but we usually like to replace both of them at the same time, just to then keep everything on that same cycle of expiration date.
Mm-hmm. Well, I think, and LifeSure, I can't remember now. You have been in existence for how long? How old is LifeSure now?
Since 2015.
Okay, so 8 years. Wow. And how many are you? Because your success rate's incredible. So it make you think that maybe you have an army, but maybe you're more like SEAL team.
Yeah.
We are a SEAL team.
We're a smaller team here of 8, but everyone that we have, we're growing, but everyone that we have here works like 10 people. So each one is their own one-man army or one-woman army.
You really are SEAL team.
We are.
Really, LifeSure is N equals 8.
Yes.
Wow, so I've learned something completely new that I didn't know before, because I just assumed, given what you guys do and how well you do it, that I would never have guessed that was the size of LifeSure. So I think that's one. It's amazing what you can do when you're staffed with amazing women. Number two, when you have vision and passion for a life-saving mission, people tend to not accept no for the answer. And
Absolutely.
so thank you. I just want to thank you on behalf of my patients and families that you serve. Thank you for your partnership with the SADS Foundation, and all the best to you as we together will be doing our own things throughout this rest of this Sudden Cardiac Awareness Month. So it's been a treat for me to get to meet you, Jackie, and you, Meg, and all the best to the two of you.
Thank you so much.
Yeah, thank you so much for having us. This has been truly an honor and very fun.
Well, great. Have a wonderful weekend, and we'll see you at one of our upcoming meetings. So thank you. And it looks like we have, Aaron, 9 minutes on the counter, and a couple announcements. And I see a question that's come in, and two good ones that have just newly come in. So I'll give the announcements first, because I was thinking about that. 15 days from now, Saturday, October 28th, there's another SADS Foundation family seminar, this time in Iowa City, Iowa. Born and bred Iowa. I love Iowa. This one's at the Stead Family Children's Hospital in Iowa City, University of Iowa. So go down there. I'd love if I could have gotten down there, but I have a commitment. Otherwise, I would be there. And that'll be a wonderful seminar. The seminar that we last did in Nashville, Tennessee, I think it was fantastic. So Marcia in our staff and education, she's incredible. So thanks, Marcia, for your work on that. And now there are just a thank you to you, Meg and Jackie, from Jenny, for the help you've provided to their family and their 12-year-old daughter. So what they do is one by one family at a time, refuse to take no for an answer, turn 95% defeat or denied into near 100% success rate. LifeSure is pretty incredible, I must say. So here we go. Back up to Jaded. I hope I didn't say your name wrong. It's a beautiful first name. But she's sharing us with their family. They live in South Africa. So welcome to SADS Live. I just saw a patient here on campus from Johannesburg, a wonderful family from South Africa. So it means a lot. And your daughter just got a loop Holter implanted recently. It's called a loop recorder, which is a rhythm spell correlation device. It's a tiny, tiny gadget. I like them. I don't need them very often, but it's where we can capture a spell if it doesn't quite make sense to us, and then help understand what's going on, maybe solve a dilemma, a diagnosis. And the family's just trying to get things figured out. I would just say, Jaded, that you really don't need the loop recorder information to add an AED as part of safety gear. I don't think it's crazy to think that eventually an AED may well be part of every household, because the number one presentation is sudden cardiac arrest in middle-aged and elderly. I guess that's my age. Full disclosure, I personally don't have an automatic external defibrillator in our home. I have thought about securing one for our lake home for my wife's mom and dad, just thinking there is no way a first responder would get us at the lake within 3 minutes. And so I find myself inching closer to adding this safety gear to our own family safety package, just like I have that fire extinguisher, but I personally have not yet done that myself. So just want to hold myself to what I share with you. This is a good one. I love this one. Can I describe the steps for a woman with long QT syndrome that becomes pregnant? I assume that means not how to become pregnant. Just kidding. When is the baby tested? How and what are some of the likely treatments for a newborn? We are going to do, that's so great. We could do a whole program on pregnancy, labor, delivery, postpartum for our moms or our potential babies with long QT syndrome or CPVT, because there might be different issues if the potential transmission comes through the dad. But what if it's the mom who actually has the genetic heart condition herself? What are the issues for her? What are the issues for her developing baby? What's the transmission risk? And how do we debunk some of the myths? So I love this. We're going to answer each and every one of those questions in the early part of 2024 on a full program. I think we're not doing it very well in terms of what we communicate. I think we're making moms and dads very worried. There are physicians out there who tell the moms and dads, do not create a child with long QT syndrome. Do not get pregnant. That's hogwash. That's cruel. That's incompetence on that healthcare provider. We can almost always navigate your pregnancy successfully. We can almost always navigate monitoring your in utero child well. And it doesn't have to be anxiety provoking. And so we're going to do that program. I want moms and dads to be excited about that, not afraid. I want them to be hopeful, not fearful. I don't want them to be thinking maybe we shouldn't create a child when absolutely you should and you can. I personally do not view you, the pregnant mom with long QT syndrome, as a high-risk pregnancy. I know there are those who do, but I think that is then conveying the wrong setup. And so the program's coming. We're getting the right people in line, but just we'll walk you through that. We'll show you how there's no more baby snatching that needs to go on, meaning I've had so many families where their beautiful babies born and within seconds they're grabbed to get the ECG, and don't let baby mom and dad have that beautiful initial bonding. So we try to make it, as my kids used to say to me, chillax, dad. We try to make it way more relaxed, way more as it ought to be, a beautiful moment, not a scary one. So I can't wait to do that program for you early in the year. And we have approached, let me see. I can't wait to see you too, Jenny. And I'm looking forward to that. So she's saying she's going to see me on the Florida campus. It took me 20 some years to realize that maybe it might be kind of a good idea to see my families on our Mayo Clinic Florida campus, say the month of February, and the Mayo Clinic Arizona campus, say the month of March, instead of staying here in Rochester, Minnesota. So I'm a slow learner, but I'm catching on. And so far, last year had a wonderful time, and I can't wait to go to those two campuses in February and March. And the last question with 2 minutes on the counter is from Jennifer. Can an ablation be effective in catecholaminergic polymorphic ventricular tachycardia? And the short answer is probably not. But there are times where we better be really sure that that's the correct diagnosis. Just saw a wonderful gentleman, within the last 2 weeks, who was diagnosed at St. Elsewhere with CPVT. And yet arriving here, and we conclude without much difficulty, no way, no how CPVT. Instead, a different entity that's kind of a mimicker. But what's the difference about it is it would be amenable to ablation. So if it's truly genetically mediated CPVT, then probably not. I don't even know if we've ever needed to try an ablation in any of my patients with CPVT, but I'd want to make sure that that's really the correct diagnosis. And with that, I leave you. And the final chat came from one of my most favorites. You're all my favorite, but hi, Lene. Great to see you. Give a hello to your lovely daughters. And really, all of you are incredibly special. You are our why. You are why the SADS Foundation exists. You guide and motivate every decision we make. And we together want to do this journey together so that you can have the confidence that you deserve, that you will and can and should live and thrive despite your diagnosis. Well, that's a wrap. I can't wait to be with you until the next time, which is 2 weeks from today, October 27. I'm going to be interviewing a really special young woman, Allison, and her survival story from sudden cardiac arrest. So do join us back in 2 weeks. Until then, have a wonderful weekend. And guess where I'm going? Yes, to go babysit my 2 granddaughters, Jaden, who will be 4 in January, and Juniper, who just turned 1. And this grandpa can't wait. And I'm leaving now. Bye-bye.